Oh no, welcome to diabetic nerve pain. Hi there, do you have diabetes? I bet you do, that's why you're watching this video. I'm gonna give you some exciting tips, exercises, and information that'll help you manage your diabetic nerve pain. Yes! Oh, hello there. My name is Anthony Leskinen, and I'm a student physical therapist assistant. Today I'd like to talk to you about diabetic nerve pain, or diabetic neuropathy. Are you having pain in your feet or your hands? Did you know that it could be diabetes? I myself have diabetes and did not realize it until I had some blood work done. Diabetic nerve pain, or peripheral neuropathy, is a condition that affects the nerves of the body that may result in nerve damage or disease. Peripheral neuropathy is the most common type, but there are several that affect the body with different symptoms. If you have any of these symptoms and would feel that you should have it checked out, please do so as quickly as possible. Diabetes often goes unnoticed until significant damage is done and it's too late. If peripheral neuropathy becomes a problem for you, treatments by physical therapists can help reduce symptoms and improve the quality of your life. Hello, it's me again. It's Tony. These are the 4 types I'd like to discuss. The 4 types of nerve pain or diabetic neuropathy. The most common type, the first type, is peripheral. It could be type 1 or type 2 or both. Some of the symptoms for peripheral: numbness or inability to feel pain, temperature changes, tingling or burning, sharp pain or cramps, increased sensitivity to touch, muscle weakness, loss of reflexes in the ankle usually, loss of balance or coordination, foot problems, ulcers, infections, and joint pain. The second kind affects the autonomic nervous system, which controls your heart, bladder, lungs, stomach, sex organs, eyes. Pretty much everything you need to live and enjoy life is affected by this one. Some of the symptoms for this: lack of awareness of your sugar levels in your blood, bladder problems, urinary tract infections, incontinence, constipation, diarrhea, or both, slow stomach empty, nausea, loss of appetite, difficulty swallowing. This is kind of like the laundry list you see at the end of commercials. They're quite long, so there is quite a few complications. Erectile dysfunction, increased heart rate, and eye problems. Really, these 2 are heavy on symptoms, so they're a little easier to decipher when you're looking at to see what type of nerve pain you may have. The third one is amyotrophy, which affects the nerves in the hip, thigh, buttocks, or legs. The symptoms are sudden, severe pain, weak, atrophied thigh muscles, trouble standing from a seated position, weight loss, and abdominal swelling. And the final one is focal nerve pain. That's a specific nerve pain, a specific nerve, and it could happen in the face, the torso, or leg. Pain comes on suddenly and can last for weeks or months before it dies down, depending on the nerve that's involved. Some of the symptoms for that one are difficulty focusing the eyes, double vision, which is a great foreigner song, I might add, paralysis on one side of the face, which is called Bell's palsy, shin, foot, chest, abdomen, thigh, or low back pain. These are the 4 types of diabetic nerve pain. If you have any of these symptoms, you're going to want to go see it. In this section of the video, I'd like to go through a few things that your physical therapist might have you do for aerobic exercise. He could suggest that you take brisk walks outside or on a treadmill in the gym. If you did join a gym, you could do low-impact aerobic workouts. If they had a pool at the gym, you could swim or do low-impact aerobic workouts in the water. Certainly, you could go buy a stationary bike or a new step and work out at home. These are some of the things that he might want you to do to condition yourself. So now I'd like to show you a couple exercises that you could do to decrease your diabetic nerve pain. One of them would be heel raises, and this is working the gastroc and the soleus, also a little anterior tibialis. Another good one that you could work your quads and your hamstrings would be chair squats, where you just go down and barely touch the chair. This has also got motion at the ankles, where you're getting some muscles firing there. These are just a couple exercises that you could do. Keep blood flowing, keep yourself conditioned, keep your ankles and your legs Last thing I'd like to talk about is balance. If you have diabetic nerve pain or nerve damage from diabetes, chances are your balance might be an issue. So your physical therapist might show you a few things in the clinic to work on your balance and then send you home with a home exercise program so you can continue to work on these things at home. First thing he might have you do is a single leg raise, holding on to something, working on each leg's ability to balance under its own power. Then take the hand away, arms out to the side. This is my bad side, the left side. This is a little better. And to increase that, bring your arms in. These are all progressions. Another one might be a side leg raise, bringing the leg out to the side with your hands in. Just a few simple exercises that can help you improve your balance if you have diabetic nerve pain. So I have a paper patient. His name's Antonio, and he's got diabetic nerve pain because he has diabetes. A few things the doctor might have him do are take some medication to manage your blood sugar. Metformin is a popular medication. I take 2 of these a day. Antonio does. Then you'll most likely do a B12 vitamin and a low dose aspirin or a baby aspirin. And then if you have high blood pressure, some high blood pressure medication. I take 2 of these, Antonio does, 2, 1, 1, and 1, every morning with my first meal, breakfast. So the difference between a doctor and what a physical therapist can do for you is the doctor's going to manage your symptoms internally. Physical therapist is going to manage the systems of your body to help you with your nerve pain and your diabetes externally. He's going to help with muscles, strengthening, balance, and really, if you continue to work on those things, some people have even been known to not have to take medication anymore, especially in the type 2. Type 1, you're going to have to take insulin. Your body isn't producing insulin, so that's where the shots come in. And you have a few different types of insulin. You've got short, rapid, intermediate, fast-acting, long-acting insulin, and basically different types for different people. Okay, so some of the things that Antonio might be prescribed by a physical therapist in a home exercise program would be if he does have swelling or inflammation from exercising, he might have him ice it. You could also do E-stim in the clinic to control pain, or maybe be sent home with the TENS unit so you can control your pain at home. Another thing you want to do is really watch your diet. Your doctor is going to say, hey, these obviously don't eat really sugary foods. Candy's out, cookies, cakes, all those things. The limit. He's going to tell you, maybe you have 40 grams of sugar to play with each day, so you want to be careful. A lot of the time, Antonio, what he does is he also tries to cut out gluten, because gluten is a great carrier for sugar in your blood. So it's not just the sugar, there's other things that you have to stay away from. I'm going to test myself and see what my blood sugar is, and it's going to be imaginary because really this is Antonio's number, but I'm going to have my kit right here, and I'm going to just see exactly what my blood sugar level is. These come in a nice little kit. You pull out a testing strip, and you don't need to turn it on. Just putting the strip in to the tester will turn it on. Then you have a little needle here, and you set it by cocking it back, and then you just press this button. I usually switch fingers, or Antonio does, because one finger can get sore. And it just quickly jabs you. Squeeze your finger to get a little drop of blood. Go ahead and put that blood into the tester strip. It'll count down 5, 4, 3, 2, 1. And right now my blood sugar is 105, which is excellent. I'm really looking for 100, 110, so 105 is right in that zone of where Antonio would like to be. After a meal, it will spike, but I haven't eaten since breakfast, or Antonio hasn't eaten since breakfast, so 105 is great. I'm very pleased with that. He's very pleased with that. So that's just a simple rundown on some of the medications and how to test your blood.